Hello, my name is Dr. Dewan S. Raja. Today I will discuss about celiac disease. What is celiac disease? Celiac disease, also known as celiac sprue or gluten sensitive enteropathy, is an immune mediated disorder triggered by the ingestion of gluten containing foods such as wheat, rye, or barley in genetically predisposed individuals. Celiac disease has an overall worldwide incidence of 0.6% to 1%, but its prevalence varies widely among countries and regions. Because many countries they use rice as their staple food, not the wheat. But due to mobilization of food from one part of the world to another part of the world, so the prevalence is going to be high gradually. When individual with celiac disease consume gluten, their immune system responds by attacking the lining of the small intestine. This immune reaction damages the villi. Villi are finger-like projection from the luminal surface of the small intestine. Small finger-like projection that line the small intestine and plays a crucial role in nutrient absorption. So if villi are lost, then there will be decreased surface area for reabsorption. So nutrient will not be absorbed to our system. Genetics of celiac disease. Celiac disease has a strong genetic component. The primary genetic risk factor associated with celiac disease is the presence of certain human leukocyte antigen HLA genes, specifically HLA-DQ2 and HLA-DQ8. However, having this gene does not guarantee the development of celiac disease. Many people with this genetic marker never develop the condition. These genes are involved in the immune system's response to gluten. There may be family history of celiac disease because it runs in the families. In many cases, immunology and pathology of celiac disease. Celiac disease is an autoimmune disorder characterized by an abnormal immune response to gluten. So celiac disease is little bit different from gluten hypersensitivity to some extent. This is an autoimmune problem. And gluten sensitivity, this is a little bit different entity with less problem. The immunology of celiac disease involves several key components like antigen presentation, HLA genes, T lymphocyte activation, cytokine release, antibody production by the B lymphocyte, intestinal damage, innate immune response, not only T and B lymphocyte, also intraepithelial lymphocyte take part in the inflammatory process, autoimmunity and cross-reactivity. Okay, so multiple tissue may be damaged due to celiac disease. Symptoms and complications: diarrhea or constipation, abdominal pain, bloating and gas, usually more chance to have diarrhea. Weight loss, malabsorption of nutrient can lead to weight loss, fatigue due to nutrient deficiencies and malabsorption, anemia resulting from insufficient absorption of iron, folic acid and vitamin B12, osteoporosis, reduced absorption of calcium and vitamin D can lead to weak and brittle bones, dermatitis, herpetiformis, skin rash, characterized by itching and blistering lesion, joint pain, headaches, infertility, gastrointestinal cancer, specifically lymphoma of the small intestine like duodenum, jejunum, may be associated with that of the celiac disease. Primary biliary cirrhosis, liver damage, we may also say some type of pancreatic insufficiency seen in many cases. Neurological complications on individuals with celiac disease may experience neurological symptoms such as headache, peripheral neuropathy, ataxia, and seizure. Diseases associated with celiac disease like type 1 diabetes, autoimmune thyroid disorder, rheumatoid arthritis. Autoimmune thyroid disorder may be hypothyroidism, may be hyperthyroidism. It may be Graves' disease. It may be Hashimoto's thyroiditis. Rheumatoid arthritis, systemic lupus erythematosus, Sjogren's syndrome. There will be drying of the parotid gland and the lacrimal gland happen in Sjogren's syndrome. Addison's disease, okay, due to damage to the adrenal cortex. Dermatitis herpetiformis, itchy condition with blister on the skin with an association with that of the celiac disease. Okay, diagnosis of celiac disease, medical history is very important. Physical examination, we look for anemia, weight loss. Okay, the most common antibodies tested including anti-tissue transglutaminase antibodies, anti-endomysial antibodies, and anti-demyelinated gliadin peptide or DGP antibodies. HLA typing, presence of HLA-DQ2 or HLA-DQ8 genes, biopsy and endoscopy. Okay, we pick up the tissue from the intestine, we study under microscope. Response to a gluten-free diet. Okay, there is some challenges given with gluten with doctor supervision to find out whether it is hypersensitive to gluten. The doctor can find out that. It's a challenge test. Histopathology, we're looking at that. These are the villi, finger-like projection. It will be damaged visually, it will be like this. In this way, surface area for absorption of nutrient is decreased, so there will be diarrhea. Okay, so the intestinal gland seems to be larger and it is buried in the lamina propria. Okay, we have complete loss of villi. Okay, and their dense plasma cell infiltrate will get a lot of plasma cell, lamina propria, and intraepithelial lymphocyte will get between the epithelials will get lymphocyte. Those are associated with innate immunity, so it causes inflammatory response along with that of the T lymphocyte and B lymphocytes. Treatment of celiac disease, how can we treat? Number one is gluten-free diet. The only effective treatment for celiac disease is a lifelong gluten-free diet. This involves avoiding all sources of gluten, including wheat, barley, rye, and any other derivatives, like that of salad dressings, some type of ketchups. Okay, so that should be avoided. Nutritional support is very important because of malnutrition, malabsorption. So we need nutritional support. Monitoring follow-up, educational support. People with gluten sensitive colitis like celiac disease should know what food has more gluten. Okay, so they should have health education to avoid the gluten rich food, and support group will help a patient with their practical experience. They can share the information very frequently by means of the support group. And that's all about the celiac disease. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.